Welcome to This Week in Psychiatry. This week, we're covering 10 notable papers spanning the biological architecture of mental illness, new directions in therapeutics, and key issues in clinical diagnostics and decision-making. Let's dive in. Our first theme this week is the biological architecture of mental illness, with several papers using neuroimaging and genetics to refine our understanding of anxiety, panic, and general psychiatric risk. 2 studies in molecular psychiatry challenge and expand our neurobiological models of anxiety-related disorders. First, a meta-analysis of functional neuroimaging studies in panic disorder moves beyond the traditional focus on fear circuits. Instead of isolated amygdala dysfunction, the authors identified a consistent pattern of increased activity in a prefrontal hippocampus brainstem axis. This network was spatially associated with serotonergic and dopaminergic receptor distributions, suggesting that panic disorder involves widespread alterations connecting higher-order cognitive systems with evolutionarily older brainstem processes related to arousal. The second study used fMRI to explore avoidance behavior, a core feature across anxiety disorders. The investigators found that 2 transdiagnostic traits, anxiety sensitivity, or the fear of fear, and intolerance of uncertainty, the fear of the unknown, have distinct neural underpinnings. Specifically, anxiety sensitivity amplified the relationship between threat reactivity in the insula and avoidance behavior. In contrast, for individuals with high intolerance of uncertainty, their avoidance decisions were less aligned with preparatory activity in motor and parietal cortices. This suggests these 2 traits, while often co-occurring, might drive avoidance through different pathways, potentially requiring tailored intervention strategies. Moving from brain circuits to genetics, a foundational paper in Nature provides a new lens for thinking about the genetics of complex traits, including psychiatric disorders. The study shows that while traits are highly polygenic across the general population, the extreme ends, or tails, of the distribution have a distinct and less polygenic architecture. In these tails, rare genetic variants with large effects become the key drivers. This has significant implications for psychiatry, where we often work with individuals at the severe end of a trait continuum. It helps explain why genome-wide association studies focusing on common variants have had limitations in predicting severe illness and points toward the importance of sequencing for rare variants in this population. A study in JAMA Psychiatry provides a direct clinical application of these genetic principles. Researchers in Denmark analyzed the joint contribution of rare, recurrent copy number variants, or RCNVs, and common variant polygenic scores, or PGSs, to psychiatric risk in over 94,000 individuals. They found that both RCNVs and disorder-specific PGSs independently increased the risk for autism spectrum disorder, ADHD, and schizophrenia. Interestingly, for a given level of absolute risk, PGSs identified a larger number of at-risk individuals than RCNVs did, except for autism. The study also found evidence of a negative interaction, where the risk conferred by some RCNVs was attenuated in individuals with a low polygenic score. This highlights the complementary value of these 2 genetic measures and suggests that PGSs could one day help stratify risk even among carriers of high-impact rare variants. Our second theme covers new and expanded approaches to treatment, from novel pharmacology to the therapeutic potential of everyday activities. The British Journal of Psychiatry features the RESTAND study, an early-phase trial of a novel 5-HT4 receptor partial agonist, PFO4995274, for depression. In a 7-day double-blind trial, 90 participants with unmedicated major depressive disorder were randomized to the novel agent, citalopram, or placebo. As expected, citalopram produced the classic early effect of reducing the recognition of negative facial expressions, a behavioral marker of reduced negative bias, which correlated with decreased amygdala activation. In contrast, the 5-HT4 agonist did not alter this negative bias or amygdala activity. Instead, it increased activation in the medial frontal cortex, a region associated with cognitive control. Despite these different neural targets, both active treatments led to early reductions in observer-rated depression severity compared to placebo. This suggests the 5-HT4 agonist may represent an alternative mechanistic pathway for antidepressant action, possibly through procognitive effects, supporting further clinical investigation. Shifting from pharmacology to behavior, a personal view in the Lancet Psychiatry explores the inherent commonalities between arts-based leisure activities and formal psychological therapies. The authors argue that activities like playing music, creative writing, or visiting cultural venues can produce meaningful psychological benefits by targeting the same transdiagnostic processes as therapy, namely cognitive, emotional, social, and behavioral regulation. They discuss how these activities activate therapeutic principles and share contextual factors like building relationships, fostering positive expectancy, and shaping identity. While distinct from formal creative arts therapies, the piece makes a strong case for considering arts-based engagement as a supportive component of mental health care and calls for more research, including head-to-head trials, to define its role in clinical pathways. Our final theme focuses on clinical practice, with papers on diagnostics, comorbidity, and the very framework of clinical decision-making. First, a study in molecular psychiatry proposes a potential biomarker-based screening test for a subtype of autism spectrum disorder. Researchers measured microbially derived metabolites, or MDMs, in the urine of children with and without ASD. They found that children with ASD had significantly higher concentrations of multiple MDMs, including those derived from phenylalanine and tryptophan. Nearly all children with ASD had at least one metabolite at a concentration higher than any of the typically developing children, with an average of 3 such elevated metabolites. Using the presence of one or more elevated MDMs as a classifier yielded a sensitivity of 90% and a specificity of 100% in the sample. The authors propose this could be a non-invasive screening tool and suggest the existence of a distinct phenotype, which they term ASD associated with microbially derived metabolites, or ASD-MDM, that may comprise up to 90% of children with the disorder. Next, a critical meta-analysis from the British Journal of Psychiatry highlights a major medical comorbidity in our patients. The review, which included 48 studies, examined the prevalence of chronic kidney disease, or CKD, in people with severe mental illness. The pooled results are stark. People with SMI had significantly higher odds of having CKD compared to those without SMI, with an odds ratio of 2.33, which translates to more than double the risk. The pooled prevalence of CKD in people with SMI was 8%, and was highest in studies focusing specifically on patients with bipolar disorder, where it reached 15%. Although factors like psychiatric medications and higher rates of diabetes likely play a role, the authors note the drivers are under-researched. This finding is a direct call to action for clinicians to be more vigilant about monitoring kidney function in patients with severe mental illness. Finally, 2 papers challenge us to think more deeply about the process of clinical decision-making itself. A review in JAMA Psychiatry examines how we establish clinical decision thresholds. The authors argue that relying solely on diagnostic cutoffs is often insufficient. They review 4 alternative strategies for setting thresholds on continuous measures of psychopathology. First, using statistical deviance from a population norm, as is common in neuropsychology. Second, referencing levels of functional impairment. Third, linking thresholds to the probability of a specific negative outcome, a common practice in internal medicine. And fourth, basing thresholds on the costs and benefits of a clinical action. The paper makes a compelling case that psychiatry has underused these approaches, and that we urgently need research to develop more nuanced, decision-specific thresholds. Complementing this, a call to action in the British Journal of Psychiatry proposes that it's time for evidence-based medicine to evolve by incorporating a fourth pillar: patient-level data. The authors argue that alongside clinical expertise, research evidence, and patient values, we must systematically integrate data collected from individual patients over time to guide and personalize treatment. This aligns with the need for better decision-making tools and emphasizes a move toward a more data-informed, individualized approach to psychiatric care. If you only have time for one paper this week, make it the meta-analysis on chronic kidney disease in severe mental illness from the British Journal of Psychiatry. It provides clear evidence that our patients have more than double the odds of having CKD, underscoring the urgent need for routine kidney function monitoring in this vulnerable population. Here are the key takeaways from this week in psychiatry. First, start screening your patients with severe mental illness for chronic kidney disease. This week's meta-analysis shows they face more than double the risk compared to the general population, with the risk appearing particularly high in patients with bipolar disorder. Second, new research is challenging traditional neurobiological models. Panic disorder appears to involve a broad prefrontal brainstem axis, not just fear circuits, while distinct anxiety traits like fear of fear and fear of the unknown show different neural signatures for avoidance behavior. Third, a new class of potential antidepressants, 5-HT4 receptor agonists, may work through a different mechanism than SSRIs. Early data suggests they may enhance cognitive control via the medial frontal cortex, rather than by dampening amygdala reactivity. Fourth, keep an eye on the gut-brain axis in autism. A subset of children, perhaps up to 90%, may have a distinct phenotype defined by high levels of microbially derived metabolites in their urine, which could one day become a valuable screening tool. Finally, the genetic architecture of psychiatric risk is complex, involving both rare, high-impact variants and common polygenic scores. These tools are becoming more refined and may help stratify risk, even for carriers of high-risk mutations, moving us closer to personalized risk assessment. That's your roundup for This Week in Psychiatry. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week.